from Pfizer today. Emma and I, we've known each other for a while. Someone I know is passionate about the patient, passionate about getting medicines to patients around the world. Emma, it's a real delight to be with you today. So thank you very much for taking your time.
Thank you, Cary.
Now, we have a couple of questions, but we'll probably talk around them as well. So I've got a question which is about, could you just tell us a bit about yourself? Because you have a very interesting background. I've been reading about it, so I know it's interesting. But tell us about yourself so that the people who are watching this can get a feel about you and what drives you and your values, et cetera, et cetera.
Sure. Thank you again, Cary. So currently, I serve as Pfizer's Vice President of Global Patient Advocacy. And my career at Pfizer spans over 2 decades. So I've had many roles with increasing responsibility in operations, clinical research, strategy, medical affairs, and now I have the privilege and honor of running global patient advocacy for Pfizer. But for some additional context, I'd like to give you a little bit about my background, my personal background. So I was born in Uganda, and my family fled Uganda during the Idi Amin era, and we resettled in Abidjan, Cote d'Ivoire. There, my mom, who's a nurse midwife, by training, volunteered at a rural community health center. So really at a young age, Cary, I became acutely aware of the inequities when it came to access to healthcare and access to medicines. So really that led me to pursue a Doctor of Pharmacy degree. And like many of us in pharmacy, I started out my career in the hospital and community settings. And during my time as a practicing pharmacist, I was really surprised when patients came up to pick up their prescription, not fully understanding their diagnosis, let alone the medicine that was prescribed to them. And really that is when my passion for health literacy was born. So I believe that it's healthcare professionals' responsibility and other stakeholders in the healthcare ecosystem to make sure that medical information shared with patients is shared in a manner that patients can understand and that leads to patient activation. So at Pfizer, also as a clinician, I worked on clinical trials in Africa and also worked on health literacy projects in Anglophone and Francophone Africa. So at this Congress, I've had the honor and privilege of meeting quite a few UICC members from Africa. I'm hoping that my interactions with attendees will raise awareness about the work Pfizer is doing to help address health disparities and how health literacy, although not the only tool, can really help advance health equity, because I believe a patient who understands their medical information becomes an empowered patient, and an empowered patient shows up differently. So that's a little bit about me, Cary. And I was thinking now that I would turn the tables and ask you a question. So one thing that I'm hoping to get out of our time together is a better understanding of the greatest capacity challenges that patient advocacy groups, and in this context, oncology patient groups are facing today. And what do you see as the head of UICC? What is the best, most effective and sustainable ways that organizations like Pfizer can help support capacity building?
Well, Emma, you mentioned the Congress, which obviously occurred recently in Geneva. And for me, it was just fantastic to see the community face-to-face again. I don't know about how you felt. We've had so many Zoom and team meetings and webinars going on for so long. It was great to meet and greet so many leaders of patient groups from around the world. And in my conversations with them, there are lots of challenges they're facing at the moment, lots of challenges. One of the things that UIC is focused on probably the last 4 or 5 years is about just the organizational competence to run an organization, the leaders, the support they need to help each other and guide each other and best practice on how to run an organization, but also on things like strategic planning, okay, something that we don't think about really, business planning, operational design, how to work effectively with a group of individuals and volunteers that are remote from the central organization. And even things like advocacy, how to embrace online technology to do fundraising and advocacy. So there's a key area where UIC has worked in the past. And I do believe that companies that, now you have, I'm sure, Pfizer, you have wonderful training on management and leadership and emotional intelligence, all these sort of things. These are things which a lot of the smaller patient groups don't have access to. And yet we all know that if you can invest in the welfare of an organization's operational management, you are investing in the long-term survival of that organization. The second point, and when I raised it then, was about funding. the last 3 years through COVID have been horrific for patient groups, horrific. Not only did they lose access to gala dinners, road races, cycling races, all sorts of things that brought in cash during the COVID time, but now we're seeing still a focus on COVID in many countries, where that's where the civil society and governments are working and operating to improve things. But we're also seeing the economic consequences of the investment that governments made in addressing COVID and improving the health system. And we know that cancer patients are in many countries being left behind, or screening has been cancelled so that we're not identifying cancer patients early enough. So there's an area where, even some small funding available to the patient groups in low middle income countries particularly can make a massive change to the way in which they can operate effectively within their country. And I think you and I have seen that in the past, more certainly given your background. The third thing I think is important is to help patient groups advocate. Okay, the voice of patients is so important in every discussion that takes place at a national level. We have been maintaining for years a country needs a national cancer control plan, but a key stakeholder in that has got to be the patient groups. But they really do lack the training, experience, knowledge, and ability to advocate successfully with so many competing demands and voices saying what's important in health in that country, particularly in some countries where the communicable diseases are still very important to be addressed. So there's an area where investment in training on advocacy can make a difference. The last thing is, if you ask me what you can do as a company, what companies like yours can do, it's work very much at what your core mission is. Okay, we really appreciate working with companies like you. We really appreciate the support, the guidance, the advice, the funding that you can make available to UICC members. It really makes a difference. But what you do, which is unique, is you produce innovative new medicines that can cure cancer. And that is where we want you to be massively successful in the future and fulfill what you said earlier and the company's mission to make those medicines available around the world. So, the game changer that you could do as a company is find a breakthrough medicine in 5 years' time that not only cures a cancer, much better than any other drug that's available, but it's available globally in a short period of time. So anyone who gets that cancer knows that they've got Pfizer holding their hand through their journey, because that medicine is going to save their lives. And I really appreciate that. Earlier this year, you launched a Record for a Healthier World. And I know you're following through on that with your commitment to make medicines available in low-income countries. UICC, with our partners, have developed now the ATOM Coalition, Access to Oncology Medicines Coalition. And these are examples where companies working with others, working with governments, can make a difference to the patients. And ultimately, I think all patient groups, given their name, care about patients. Can we get them on trials? Can we get the medicines to them? Can we get the treatment to them? And then we can all be content that we've done the very best we can with the technology available to make a difference. So these are the areas where I think companies can make a difference to patient groups around the world. At the end of the day, I mean, you must get very, very excited when you see, the final trials coming out on a medicine that can make a difference on a cancer. It must be a real buzz across the company.
Yeah. And Cary, you touched on a few points really where I feel that this is areas of mutual interest. One thing that unites all of us, I think, who are doing this work is our desire to make sure that everyone has access to innovative medicines. So there's a saying in the US, your zip code should not dictate what kind of healthcare you have or what kind of medicines you have. So your country of origin should not dictate that as well. So I'm glad that, you have the ATOM, we have the Accord, but it's going to take a partnership. It's going to take all of us working together. Like I remember in our conversation, you said it's not just enough to get the medicines to the port. It's that final mile. It's going to take partnerships like with you and other organizations to get those medicines into the hands of patients that are waiting. And then another area that you mentioned that I'm really also, again, really fascinated and so excited that you brought up is that leadership training. So, when I think about, what is that capacity building for patient advocacy groups? And one thing that I've heard over and over again is that, capacity building of patient advocacy groups, whether it's around leadership capabilities, strategy, starting up an organization, those are things and capabilities that we already have. So how can we create a platform that can offer all these offerings to patient advocacy groups that need to be built up? So there's a lot going on, but one thing I'm really excited about is we want to launch a platform that just does that, where we have these resources available for capacity building for patient advocacy groups. Because let me tell you, Cary, I think there's no doubt in my mind that we're not going to be successful in what we do without the voice of the patient advocacy groups, like I always say, and patient advocacy groups that are empowered, because an empowered patient shows up differently. So patient advocacy groups, our partnership with them is what's going to help us be successful. And by success, I mean making sure that our innovative medicines are accessible to all patients, not just some, but all patients.
Well, I mean, I think probably about half of UIC members are patient groups. So we represent their voice at a global level, and we're negotiating with the World Health Organization, the UN system, on the various high-level meetings that take place. But you're right, that patient engagement at national level is really critical. It's really critical. And interesting enough, I think that where we have seen progress in national cancer control planning, there's a strong correlation with the degree to which the planners have reached out to the patient groups in that country to get them engaged in the process at the beginning and throughout. And certainly, we review a lot of national cancer control plans, and the worst ones are written in isolation, not funded, and tick the box. And then you have others which are really, embrace the community, understand the data, make the right policy decisions based on priorities and the advice of WHO, and include the patients all the way through that process, because then it's owned by the community and they feel it's real. So now, you mentioned earlier, I've got a couple of questions. One is, now you mentioned your early life in Africa, and yet now you're in New York. So you've got to explain that transition. I mean, what happened there? You didn't just it just happened. I mean, what happened to take you from that place of growing up and seeing what your mother was doing, etc.? Well, how did that happen?
Yes, so that's a really interesting thing that happened. So, I was born in Uganda, and then Idi Amin happened. So I was really young, but we had to flee because of conflict in Uganda. So we resettled in Abidjan, Cote d'Ivoire. And my dad was a diplomat, so he worked for the African Development Bank. And my mom worked she's a nurse midwife by training, actually trained in the UK. My dad also trained in London, went to the London School of Economics, and then ended up at the African Development Bank. But it's there when I saw that, I had access to healthcare and medicines, but not everybody did around me. So I always questioned, how can we really create a more equitable world? And that led me to my studies first in Canada and then in the US. And then
that's the connection. Then there we go.
My dad said he sent his kids to university and nobody came home, because chances are you meet your better half, in college. So I met my husband. He's originally from Cape Verde, but second generation American. And then we raised two lovely girls. And actually one is now living and working in London. And the other one is a junior in college.
So there was a romantic story behind that.
Yeah, a romantic.
Now, you also, the other thing you mentioned was about health literacy. And I think we agree that, a health literate community will demand work with governments to make sure that they understand what's needed to improve their health over the longer term, but also the family, the friends, and things like that, because people become aware, and there's a lot of misinformation out there about all sorts of things at the moment. But tell me about your passion for that, and how specifically is Pfizer helping in health literacy?
Yeah, so really, to me, I think it's my background as a pharmacist that really sparked this idea of health literacy. I just couldn't understand how patients left their doctor's office, came to pick up their medicines, but when you ask them about their diagnosis, they're like, well, I don't know, I think, I'm not clear, and this medicine, yeah. And I realized really health literacy could be a barrier to adherence and poor patient outcomes. And yet, Cary, the confusion, people really don't realize that health literacy is a modifiable risk factor. Unlike literacy, where you have to go to learn school, health literacy is modifiable. And I believe it's a responsibility of healthcare professionals and people in the health ecosystem to make sure that medical information we share is shared in a manner that patients can understand and that leads to patient activation, because that means if a patient understands their medical information, they're an empowered patient. And an empowered patient, I always say, shows up differently. So at Pfizer, we've done a few things. We've actually now we developed a health literacy training module, meaning that every Pfizer colleague who develops patient-facing materials make sure that the materials that are developed follow health literacy principles. So they're shared in a manner that lead to activation. We've also, with our clinical trial data, made sure that it's written in plain language, again, following health literacy principles. Because at the end of the day, is it fair that when we, first of all, we recruit patients to be part of our clinical trials, we publish all this data, and a lot of the times you and I might be able to understand it, but someone might be highly educated, but a lawyer will not understand our clinical trial data. So we have to make sure that we write it in a language that patients can understand and that leads to patient activation. So those are a few examples of what we're doing concretely at Pfizer to make sure that health literacy is being used, it's embedded in the way we do our work, because we know that it's not the only tool in our toolbox, if you want, but it's an important factor that can help close the gap when it comes to health inequities.
Yeah, and it's important that in communicating that we think about the different populations and the language that they use. I mean, I had a meeting this morning talking about indigenous populations and how they seem to be left out of this, and it's important to reach out to them with information which is in their language so they understand it, or in a tone which they understand so they're not fearful of it as well. So I think that's great work that you're doing, and I know many others are committed to doing that. I was at the conference and I asked the question of the audience. I said, how many of you were educated at school on your health, risk factors, health systems, various diseases and things like that? And bear in mind, this is the World Cancer Congress. You think health people would be there, they've all been inspired when they're at school. Not a single hand went up. And I don't know what the situation is today in schools around the world, but wouldn't it be great if we started health literacy at school?
Exactly.
Wouldn't it be great if it was part of the curriculum? It makes such a difference. I didn't have anything. I had no idea when I left school about anything to do with my own personal health or help my family or my mum, my father are growing old, knew nothing at all.
Yeah.
Anyway, I really admire what you're doing, and thank you very much. Emma, it's been a pleasure talking to you as ever. Looking forward to seeing you in New York sometime, and I hope that you have a very good day, and we'll catch up soon, okay?
Thank you so much, Cary. This was very nice, and I really enjoyed this. Thank you so much.
Cheers, Emma. Bye-bye.
Cheers. Bye.